I'm Eileen, and I'm really excited to be sharing this information with you. I've been working with people in pain for, gosh, I'm only a couple of years away from 3 decades of doing this, and so I would love to share this with you. It's not mainstream knowledge, but it should be mainstream knowledge. So here goes. We're going to start off with what could be considered common causes of knee pain when walking. Now, aside from if you've got bone on bone in the joint, that's a given. That's not a surprise, right? But what if you don't have bone on bone? Well, maybe you were told you had something that showed up on imaging, something that showed up in an MRI. You may be surprised to hear that a lot of the times things like that show up on MRIs and people don't have any knee pain. So potentially whatever's showing up may not be the cause for your knee pain, and it's important for you to know this, right? Especially before you agree to a procedure or surgery. So, and I'm not telling anybody not to listen to their doctor. What I am saying is it's important for you to understand how the human body functions in real life authentically so that you don't have pain when you move. The goal is for me to teach you how to move without pain. So, the first thing I'm going to talk about that is a potential cause of knee pain when walking is your ankle function. If you've ever lost ankle function or had impaired ankle function, and experienced that at any point in your life, maybe you sprained your ankle when you were in college during sports, maybe you had a bunionectomy and you were non-weight bearing for a long time, right, in a boot. Well, your ankle can't function right when it's in a boot, right, for 6 weeks or whatever it is. So there's lots of reasons that the ankle may not be functioning optimally. You may not even be aware of it. You may not have any symptoms in your ankle whatsoever. You may have no clue that your ankle's not functioning properly. I consulted with a young girl a couple of weeks ago, and she literally had, her patella was dislocating, and when I assessed her left ankle, it kept wanting to turn out whenever she had moved into dorsiflexion, which I'm going to teach you what that is in just a moment. She had no clue. She's never injured the ankle even. She's 13 years old. And she said, I don't know why it's turning out when I do that. But when we got her to focus on positioning it properly, we trained that ankle properly, her knee is no longer dislocating. So it's really important that your ankle is functioning well. So let me show you the motions that the ankle needs to go through for proper function that doesn't irritate or annoy your knee. So there's something called dorsiflexion, and that's when you lift the toes up, okay? So you can see I'm keeping my heel down, that's dorsiflexion. The toes are coming closer to the front of my shin. Now dorsiflexion also occurs, that's non-weight bearing. It also occurs weight bearing. So I'm bearing weight on that foot, and when I do this, guess what? That shin, even when I do that, that shin is coming closer to the toes. That's dorsiflexion. Your ankle needs to be able to do that really well, full motion, which is about 20 to 30 degrees. And then there's another motion. The heel bone has to be able to evert and invert, which means my heel bone, when I go to do movements, and I won't get too deep, this is a quick video, that heel bone has to move out and move in, out away from the body, in toward the middle of the body, at different times of gait when you're walking. And when that happens, there's a joint above it called a subtalar joint, and that subtalar joint, depending if the heel everts, the subtalar joint drops down and in and creates this beautiful, flexible, shock-absorbing foot, so that when you're on uneven surfaces, you're walking, you don't want to be jarring your body every time your foot hits the ground, so it does this beautiful, shock-absorbing, flexible foot. It also triggers your shin bone and your thigh bone to rotate in slightly, which gets all of your other muscles doing things. It switches them on. Muscles react to motion. That's their job, to subconsciously respond to motion. And so now, guess what? Everything's working the way it's supposed to. And that has to happen in dorsiflexion, especially when you go to toe off, because then your heel bone has to invert, and now that subtalar joint rotates up and out and gives you a nice solid bony surface under your foot, so that when you go to do this, guess what? When I pick that up, I need that to be supporting me and make me really stable, right? So what happens if some of that stuff isn't working right? So I'm going to show you a very basic exercise that you can do to load those joints in all those motions and hopefully restore or enhance or improve those motions in your body. And so what you're going to do is you can put your arms up against a wall. If that bothers your shoulders, obviously you can always modify. You can use the back of a chair, which I'm going to show you this way so you can see what my foot is doing. But you can use the back of a chair, and you can also use a kitchen counter, someplace stable. So what I'm going to do is I'm going to mobilize or load or train my right ankle right now. So I'm going to put that foot back, my other foot forward. Now it's important that the foot is pointed forward and not turning out like that young woman I told you, right, about. So that heel has to stay down. If you feel that heel coming up, you've gone beyond your ability for that range of motion. And so bring your foot a little bit closer, okay? So I'm going to keep that heel back because I've got good range. I can go way back here, but for purposes, I'm going to show you here. And what I'm going to do now is I'm going to bring my hips forward, but my head and shoulders go back. This is bringing me into more dorsiflexion. And we want to be loading and unloading, loading and unloading. You're keeping your knees straight, keeping that heel down, right? You don't want that heel to come up. And you're going to get that beautiful dorsiflexion load in that foot and ankle. Okay? Now, once you've done that, there's 3 planes. We've got to get that heel to evert and invert, right? We have to get the foot to pronate and supinate. I won't go into all that. But know that all those motions are important. So what we're going to do now is after we've done that 10, 15 times, as long, obviously no pain, okay? I'm going to come forward. And now what I'm going to do is I'm going to have my hips go side to side, kind of like if I had parallel bars and I wanted to tap them, right? And what this is going to do is this is going to mobilize that heel bone so that it's inverting and everting. But it's in dorsiflexion because I'm forward, my shin is closer over my toes, okay? So you get that nice side-to-side motion. And then the last one, again, you can do that 10, 12, 15 repetitions as long as there's no pain. And if you notice, you can have your hips go right and there's no pain, but when your hips go left, there's a little bit of pain. Then only have your hips go right and straight, right and straight. You may notice after a few days, you can do the full motion. All right? Now we're going to do rotation, which is going to give us some supination, pronation of that foot and ankle, nice and healthy motion. So I'm going to have my hips come forward again to load into that dorsiflexion movement. And now what I want to do is I just want to rotate my pelvis. I'm going to pretend I got a flashlight in my belly button and I'm just sort of flashing the light back and forth across the room. And you're going to feel the weight go on the outside of your foot, the inside of your foot. You're going to feel that. You're going to get that beautiful load in that ankle. Now, make sure there's no pain. If I come forward, say I feel a little bit of pain or discomfort or something that's not happy when I rotate left, then I'm just going to rotate to the right. Okay? So the goal here is you don't do movements that create pain. Obviously, you're going to do the same thing with both feet. Okay? Try that before you walk and see if that doesn't make a big difference when you walk. And next part of this, talking about common causes of knee pain when you walk, is going to talk about your hip. Because yeah, your knee is stuck between your ankles and your hips with no place to go. It's a very simple hinge joint. So very complex at the ankle, lots of mobility at the hip, and those 2 areas, one or the other, or both, may just be the culprit and the reason that you have knee pain when you walk. Hope to see you in the next part.